Hello, I'm Julie, a learning disability nurse at the Willow Group. Blood tests are one of the most common types of medical test. There are many different types of blood tests, but the process is usually the same. A blood test can be used to check your general health, check if you have an infection, see how well parts of your body are working, screen for certain genetic conditions. Most blood tests only take a few minutes and are carried out by a doctor, a nurse or a phlebotomist who is a specialist in taking blood. Usually your doctor or another healthcare worker will refer you to get a blood test. If you think you need a blood test but you haven't been referred by someone, you can ask your GP. You will either be asked to come in during regular opening times to get your blood test, or you will be given an appointment. It is important to get your blood test as soon as possible after your referral. The person who arranges your blood test will tell you if there are any specific instructions that you need to follow before your test. For example, depending on the type of blood test, you may be asked to stop taking certain medications or avoid eating or drinking anything apart from water for up to 12 hours before the test. Before some blood tests, you can eat and drink as normal, but for a fasting blood test, you will be asked not to eat or drink anything except for water beforehand. This is to make sure that all the food is completely digested and won't affect the result. It's important to follow the instructions as this may affect the results of the blood test and mean it needs to be done again at a later date. When you go to the medical centre or GP practice, let the receptionist know that you have arrived for the blood test. Then wait to be called in by the doctor, nurse or phlebotomist. If the waiting area is too busy or noisy for you, you can ask to wait somewhere quiet. You can bring someone with you for support. They can also join you in the room when you get your blood test done. If you have a fasting blood test, your appointment time will be between 8 o'clock and 10 o'clock in the morning. You may be asked to fast for up to 12 hours before the test. We can offer these appointments in the morning so that you don't have to wait too long without food. When you are called in, the room may look like a normal doctor's room with medical equipment, a bed and chairs. Or it might be a room with a chair specifically for blood tests. The person who is going to do your blood test will ask you to sit down. They will ask for your name and date of birth so that they can check on the computer what test they need to do. A blood test normally involves taking a blood sample from a vessel in your arm, such as a vein. The arm is used because it is easy to uncover, so you can roll up your sleeve. Usually your blood sample will be taken from the inside of your elbow, where your veins are closest to the skin surface. A tight band called a tourniquet may be put around the top part of your arm. This makes it easier for a sample to be taken. This shouldn't hurt, but you can let the doctor or nurse know if it feels too tight. They may clean an area of skin with an antiseptic wipe before doing the test. The doctor or nurse will attach a small needle to a special container. You might feel a slight pricking or scratching sensation when the needle goes in, but this shouldn't be painful. If you don't like needles or blood tests, tell the person who is taking the sample so they can make you feel more comfortable. You can also close your eyes or look away while they take the sample. When the sample has been taken, the doctor or nurse will take the tourniquet off your arm and remove the needle. They will hold down a cotton wool pad on the skin where the needle was, or ask you to hold it down for a moment. The cotton wool may be taped to your arm temporarily, or they may put a plaster on to keep the area clean. You shouldn't feel any significant effects after the blood test, as only a small amount of blood has been taken. Sometimes people feel dizzy, lightheaded, or faint during and after the test. If this has happened to you in the past, please tell the doctor or nurse so they know and they can help you feel more comfortable. You can ask for a drink of water after the test if you need one. You'll be told when your results will be ready and how you'll be given them. You can leave the room as soon as the test is done, and you can sit down in the waiting room afterwards if you feel lightheaded. Later, you might have a small bruise where the blood test was taken. This might hurt a little bit, but it is usually harmless and will fade over the next few days. After the blood sample has been taken, it will be labelled with your name and date of birth. The medical centre will send the sample to the laboratory where it will be tested. The results will be sent back to the medical centre or to your GP. Some tests will be ready on the same day or a few days later, but others might not be available for a few weeks. If you're worried about the outcome of a test, you can bring someone with you when you have an appointment to discuss the results. Thank you for watching. We hope that you will now feel more confident going to the doctor's surgery to have a blood test. If you have any questions, you can contact your GP practice for more support.